My name is Jim Griffin, and I'm a cancer surgeon at University Cancer and Blood Center, specializing primarily in liver and pancreas cancers. So, unfortunately, pancreatic cancer is a very insidious disease. The signs and symptoms are often subtle, hard to describe by patients, and they can often be confused or attributed to more common things like reflux or gallbladder problems. And unfortunately, this leads to a lot of delays in diagnosis. Early detection is one of the biggest problems with pancreatic cancer. So unfortunately, when patients are diagnosed with pancreatic cancer, approximately 80% of them present with advanced disease. And that means that at that time, the cancer may have already spread to other organs, or it may be involving major blood vessels nearby that mean they can't get surgery to remove it. This is a cancer that can only be cured in most patients with chemotherapy and surgery. And so you need to be able to do both of those things. Early detection is important because if you can identify more patients at an earlier stage, you have a much better chance of treating the cancer effectively and ultimately curing it. The advancements in pancreatic cancer treatment come in a couple varieties. The first is very basic, and that is making sure patients who are diagnosed with pancreatic cancer have access to the treatments we already know work. And that's historically been a problem in our country because there are a lot of barriers to care. And that's where places like UCBC come in, where we can help facilitate getting patients who previously had to travel long distances and spend a lot of money to get the currently available treatments. As far as new treatments, there are several new drugs that are either in development or in clinical trials that target a very specific mutation called KRAS in pancreatic cancer. This gene is mutated in about 90% of pancreatic cancers. Previously, it's been a very difficult target for therapies, but for the first time, there are several drugs that are showing a lot of promise, and I think that will be integrated into treatments in the near future. And then finally, a lot of research is focused on harnessing the immune system to treat the cancer, and that's through things like immunotherapy and cancer vaccines. Pancreatic cancer is a difficult diagnosis to make, and I think that if you have any of the risk factors that I've talked about or mentioned earlier, and you just feel like something isn't right, it's important to talk to your primary care provider, tell them what you're concerned about, why you're concerned about it, and try to get yourself to someone with some experience in treating and diagnosing pancreatic cancer. And often that comes in the form of a gastroenterologist or another GI specialist who can assist with the evaluation, because the evaluation can be very specialized. Another thing that I think is really important is if you go online and you look at the statistics and you look at the survival for pancreatic cancer, it can be pretty dismal. But we're making a lot of progress. Patients are doing better, and there is a great deal of hope for people diagnosed with it now, because for the first time, we're having treatments that are working, and we're getting more and more patients to surgery to be able to have the cancers removed. And so while it is a tough cancer, there is hope, and we are curing people.